Hey Teresa, good afternoon.
Good afternoon.
Got a great topic for us today this week. It's a continuation from last week's conversation on your health journey, but I think a lot of viewers will find this one very informative because it's about dental health, the health of our teeth, and got a lot of cool resources to share with the people. And one thing I know about dental health is that I'm sure more and more people are coming in the know today just because it's being talked about in health circles, but still a lot of people are misinformed when it comes to dental health. And so I just wanted to talk about a word called cavitations, what this means. And it's not cavity. So we'll explain the difference between cavity versus cavitations. But you had them, I had them, my wife has them. Let's talk about how they perpetually stall a person's health. And, even when someone is seemingly doing the right thing for so long, but yet they still have these nagging symptoms or this autoimmune component they can't get rid of. Oftentimes it goes back to hidden infections that live in our mouth.
Yeah, for sure. Yeah, that when I have a person come in and we've been doing all the right things and they're doing everything I ask them to do and like really are truly doing everything and we still feel like they're stalled,
Mhm.
I'm like, let's look in your mouth. And so let's just start with a basic like definitions. A cavity is when our teeth have the enamel and there's a break in the enamel and then um there's a decay in the tooth itself. That's what a cavity is, and that's where we go in, and the dentum, of the tooth starts to decay, and so the dentist will go in and numb us up because it hurts, and clean it out, and then fill it in with. Back in the day, back when I was young, they filled it in with silver or amalgam fillings, which they're silver because of the mercury that's in them.
Mhm.
Now they use ceramic and they're white or porcelain, so you don't see them. They look the color of your tooth and they're, much less toxic. A cavitation is different. A cavitation is an area under the tooth in the bone that has literally been eaten away by something or other. Most cavitations form underneath where a tooth has been removed. So for a lot of people who, like me, had their wisdom teeth removed because even though I had orthodontia and I had like back when they did orthodontia and this is in the 70s, they didn't do palate expanders. They didn't do anything to open up my mouth and my teeth are just genetically, my dad had large teeth. I have large teeth. I don't have a big enough mouth for all my teeth, although some people would beg to differ that I don't have a big mouth, but we're not going to go there. So anyway, I didn't have enough room in my mouth for all my teeth. So the first thing they did when I got orthodontists, they took my bicuspids out. So I had four teeth taken out just to have orthodontic work to make room for my teeth to move because my mouth was very overcrowded. And I got braces the first time when I think I was like 13. So then fast forward, I get into my late teens and my wisdom teeth are trying to come in and they were impacted. And so I had them taken out. So for the most part, where cavitations will form is those areas where there used to be teeth
Mhm.
and now they've been removed because that there's a space there. It has to heal over, they'll pack it and then they'll, you know, tell you to rinse your mouth with salt water and do all the things and sometimes give you antibiotics and stuff to make sure that everything heals. Sometimes they'll put a little purse string suture in to close it up. But if any bacteria gets trapped in there at all, then that area of the bone will start to break down. And the way our bone, I don't know if any, like if you've looked at an x-ray or even if you like picture when you eat a chicken and you cut, break the bone in half, you can see that the bone is hard on the outside, but on the inside, it's hollow. And then the outside between where it's hard and the hollow where our bone marrow is this mesh-like area. And that's what, as we time, over time, as we age, when we hear the term osteopenia or osteoporosis, that's because that our bone is always turning over. So we're always making new bone. That's why if I broke my wrist, it wouldn't stay broken for the rest of my life. The bone heals because there's these cells that come along and they chomp up the old cells, and then there's like a different kind of cell that comes along and lays new bone down. So our bone is always trying to turn over, but if it's not able to turn over in the right way, or if we don't have the minerals and the nutrients that we need as we age, that's where that mesh-like area becomes the laciness of it becomes wider. There's more hollow spaces, and then it becomes weaker and weaker because there's more like air in the laciness of the bone. In a
Hmm.
cavitation, all that laciness just kind of gets eaten away at, and actually, because of a mixture of the bone and the bacteria will actually it'll form like this goopy, oily gunk that is in there. And this is all hidden. Like you cannot see it with a regular x-ray. So you go to a regular doctor, a regular dentist, and you get, your bite wings and your panoramic every year, for your dental cleaning and
Yeah.
everything looks fine because it's a hollow space. So the x-rays will hit the very first thing it finds, which is the hard surface of the jawbone, and then reflect back to the film a perfectly normal picture. On the other side of that hard surface is that area of cavitation. And so the only way to detect these areas of cavitation is by using something called a cone beam, which is basically a tiny little CAT scan of your face. Usually they take, a picture that like shows like the sinus area and the mandible and the maxilla, which is
Hmm.
your upper and lower jaw. And that's the only way to see it. And most dentists aren't educated in that way. They don't even bother. They don't know. So they don't know to bother with taking anything other than the kind of x-rays that we're used to seeing. And the challenge with these cavitations is, like I said, where there's this breakdown in the bone in these hollow spaces, not only does bacteria get trapped, parasites can get trapped, other things, other pathogens can get trapped in those spaces, even sometimes viruses, not always, but usually it's bacteria or mold or parasites or the things that get trapped in these hollow spaces. And then they can create this low grade underlying infection disruption. There's this low grade inflammation disruption in the whole body processes. One research article that I read showed that 70 to 80% of all disease starts in the mouth. I have an acquaintance, actually I have two acquaintances who are biological dentists that I've actually recently just spoken, like 2 weeks ago, spoke to one, and then a couple months ago spoke to the other one personally. And they're like, this is like the end all be all. We fix this, and the whole body then is able to heal because we've got this underlying low grade inflammation, low grade infection that just perpetuates. And
Hmm.
so then, like I said, if I'm trying to help someone heal their thyroid or trying to help someone overcome their chronic autoimmune or whatever, and we're getting nowhere, look in the mouth. I've either got um, mercury that hasn't been removed, or if it was removed, it wasn't removed properly. So I've got heavy metals stuck in my brain,
Yeah.
or I've got cavitations, areas of hollowness that have pockets of infection inside the mouth. And if we don't go looking, with the proper diagnostics, then we're just not going to see them. And it really, really negatively impacts a person's health in the long run. It's a pretty big deal, and it can be a real game changer in someone's health. I had a patient came to me. She came to me with Hashimoto's. She had been to like 7 or 8 doctors, including functional medicine doctors. Nobody could get anywhere. And I finally said to her, "Look, you're a little bit younger than me. You've got silver in your mouth still. You had it taken out. You had some of it taken out. I need you to go back, have the rest of it taken out, and I need you to get a cone beam. I need you to get a CAT scan of your face and mouth so that you can see what's going on. And I found her a good dentist in her area, and she messaged me like about a month later, and she said, "You were right. I'm full of cavitations. That's the issue with my thyroid, why it wouldn't heal." And I was
Yeah.
like, "Yep,
Are
yep,
you able to share your screen? Because I just want to illustrate some points here for people that are watching, because it's really important. And I know you and I, we kind of gloss over these terms that we speak about because it's just normal vocabulary for us. But like just to reiterate what you had said in
you
that,
should be able to, I made you host."
okay, cool. You had mentioned parasites hide and harbor in these places. You had mentioned
Yeah.
sometimes viruses, mold, and people are like mold in my growing in my head. Absolutely, yeah, a
Mold
lot
and
of times.
mold in the sinuses too.
Mhm.
It's moist, it's dark,
Yeah.
it's hollow.
And
Yeah.
sometimes people, when they get these wisdom teeth pulled, I remember for like most people's cases, when they get their wisdom teeth pulled, there's a piece of the tissue that's left behind
Yep.
in the surgical process, and it's dead tissue.
Yep.
You ask any individual in the healthcare profession, all of them agree across the board 100% that we do not leave dead tissue in the body,
Right.
with the exception of dentists, because you think root canals is just
Yes.
dead tissue that's left there. And so, why is it okay for
Yeah.
this governing body of people to leave dead tissue, but yet it's a
Yeah.
unanimous, not unanimous, it's a congruent across the board as a whole that we
Yeah.
don't do, we don't leave
Yeah.
tissue in the body. There's a lack of blood supply in there that allows this anaerobic, meaning these bacteria and these toxins can survive without oxygen
That can live without oxygen. Yep.
and
They're
just
and they're
multiply.
bad boys.
And you think about Lyme, a lot of people have the bacteria from Lyme
100%.
disease that live in here. You mentioned the parasites, obviously. And a lot of this is tested that when the dentist goes in and cleans this decay and these toxins out, they'll run DNA tests on it at a
Yes.
lab. That's where they find that, hey, you've got parasites in here, you've got partial Lyme bacteria in here, and you've also
Yep.
got mold or fungus,
Yep.
mycotoxins, if you will, that's harboring in these sites. And
Yep.
sometimes you can puncture a hole through the jawbone into the sinus cavity, and it just kind of makes the whole situation more convoluted. But let me share my screen because I got a couple of pretty cool images for people to get a better idea of um, just a sense of how serious this is and how this could be a missing link to your
Yeah,
health because
for sure.
it's so important. And depending on where you live, you want what you want to get is called a CT scan, a cone beam, like ice cream cone, laser beam, cone beam scan, 3D cone beam scan. And it's these holes in your jawbone right here that don't close up and heal right here. So when you have this in your mouth, you can imagine the infections, these hidden infections is what we say, that kind of harbored these potent toxins that initiate harmful immune responses to the body. And people wonder why, when they're exercising, they really do, like, they are an advocate for their health. They do all the right things. They're not eating gluten, dairy, soy, corn, or they're exercising, they're prioritizing good sleep
Mhm.
quality. They're really doing all the things that reducing toxin exposure, but they're neglecting their health, or they're neglecting their dental health. Huge breakthroughs that I've seen in people.
Yes.
They go in for the procedure, they come back. I remember I had a client of mine that I worked with. It was her and her husband. They lived down California, and she was one who like had battled for her health and like invested thousands upon thousands of dollars. Could not shake. I think she was Hashimoto's as well. Um, we had investigated that this is one area she had overlooked. She actually flew to Sweden because that's where they were from and they were visiting family. So she found a doctor over there who did everything in the same visit, which is sometimes well, anyway, she went and got all his work done. And when I met with her the next month, she was like, "Oh my gosh, this neck pain that I've had for years." Immediately after my procedure, it was just gone. And
Wow.
the pain I had in the side of my knee
Yep.
uh, disappeared, vanished. And she's like, these weird aches that I've always been battling with just completely went away.
Yep.
And I was like, what? And I always used to have this kind of like slicing liver pain. And I remember too that, and when I say slicing, it's almost kind of like when you take a really, 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 really sharp blade that you cut yourself with. you don't really feel it, but you can feel like when the air hits the tissue inside the cut, it's cold and it's like this weird feeling. I don't know how to describe it, but I remember after I got my cavitations corrected and cleaned out that I didn't experience that liver pain really anymore. And it's like
Yeah.
interesting. So it's not to say that this happens to everybody, but a lot of people have tremendous breakthroughs. And I'll give you another story of a friend of mine who's my age. He's a farmer out in the Midwest. And I remember he called me in like 2018 or maybe 17. And he was like, Chris, he goes, ever since I had this tooth pulled, I haven't been feeling the same. He's like, do you think it could be the anesthesia? He's like, for whatever reason, it seems like after I came to and I just my I have immense brain fog, and this is a really sharp man at very business savvy, was able to crunch numbers on the fly, really good bookkeeper type guy, and he was a farmer, but he was just really, really smart. And I was like, dude, you have to go get this cone beam scan. I was like, I guarantee you got what's called a cavitation. He had never heard of this. So he lived in Illinois, flew down to Texas where I had my procedure done. And he called me the day of. He didn't go under anesthesia because he still had that lingering fear in his mind that he was blaming it on the anesthesia. So he did it awake when they went through. They just did
Oh
local
my
anesthetic
gosh.
on him. And he called me while still in the recovering room. And he said, dude, it's like a cloud has been lifted off my brain. And I like these are dramatic scenarios for some individuals, but it's just to show you the power about when you go and get this corrected, how amazing the breakthrough can happen. And I was just blown away. And he was like, dude, I would have paid my entire year's salary for somebody to correct this had I known if it was something this simple. And I think the procedure cost him like 3 or 4 grand.
Yeah.
And he was blown away. And I mean,
Yeah.
still something that gives me chills because it's amazing. And I want to show a couple of other pictures that I've got here just to really illustrate the power of when we are doing the right things, we're putting all of these things together. We're trying to really get to the root of our health. Where's the share button? So this is one thing like that we always talk about, the three-legged stool. People probably have heard this. Your gut microbiome, you have pathogens, you have leaky gut, you have too many bad guys versus good guys within the bacteria. We have stressors, physical, mental, emotional, chemical. Then we have bad genes that are triggered by all these toxins. So this is how diseases arise or autoimmune conditions arise, but at the same time, it's exactly how we fix it. We have to lower all these burdens. And one place that's often heavily missed is in the mouth. And I want to show
Yeah.
you also a picture. Sorry, I've got a lot of things I want to show here. So hopefully I can share all three of them, but I don't think it'll let me. So we'll just cycle through these one by one. Can I do all three? No. All right, bummer. All right, so we'll go here. So this is a bone cavitation. So if you've ever had wisdom teeth or other teeth extracted, the lack of blood flow to the surrounding bone can lead to this basically decay and it erodes away the bone
Yeah.
essentially. And you cannot
So
see this.
real quick, osteonecrosis, bone death. That's what that means.
Yeah, necrotic tissue is just dying, is decaying away, is rotting away essentially in your mouth. And that's the fancy scientific word. We just say cavitation or unhealed wisdom teeth extractions. And
Yeah.
so you can see on the bottom left, x-rays will not show. I wouldn't say always, but I would say they never do. Pretty much 99% of the time, they don't never show it. So you have to get this 3D right here, as you
Yeah.
can see, 3D cone beam CT scan.
Yeah. Because as I said, x-rays are only meant to send those x-ray beams, hit a solid, something solid and send the picture back to the film. It hits the solid part of the outside of your bone. So it cannot see the hollow space behind the solid part. That's why the x-rays don't ever pick it up.
I used to have a meridian chart somewhere nearby, but I can pull one up. But anyway, this is the nervous system, the nerves that are connected from your teeth directly. And you can see on both shots here, all the nerves that come out of the teeth and then go all the way around the brain. So when we look in that picture on the right there, I mean, just imagine if you've had any tooth pulled or you've had root canals, you can see how now we're affecting our nervous system, especially around the brain. And then we know that the central nervous system is connected to all of our organs. So there's going to be some discrepancies, some blockages, if you will, in maybe your thyroid, or maybe you're going to have joint pain, or maybe you're going to have heart issues or brain issues. There's so many things that can stem, and you mentioned it earlier, disease begins in the mouth, right?
Yeah.
And 100% of things right here, when we look at different teeth that are missing, because almost all Americans in the Western world get their wisdom teeth pulled. Whenever there was a dentist, oh gosh, what was his name? Weston A. Price, is that his name?
Yes.
He was really a huge pioneer in studying like anthropology and just looking at different peoples and comparing them to the westernized developed countries and looking at health conditions. And he found in tribal countries over on the other side of the world that a lot of these guys had all of their teeth in perfect symmetry in their face. And
Yeah.
he alluded to a lot of the problems that Western developed countries had were because diets were shifted. Um, People were no longer being breastfed, but bottle fed, and it reshaped the palates of their mouth. I mean, this can go down into a whole nother conversation. But anyway, cavitations are really problematic. And I have one more to share here. And it's just to illustrate how an autoimmune condition, um, anywhere in the body, all of these systems here can be affected. And it can absolutely start in your mouth. The mouth is just one area. Now, if you can go back in your own personal health history timeline, the viewer, and just think, have you ever had any cavities? Have you ever had any dental work? Have you ever had teeth pulled? How many times have you
Root
had
canals.
root canals? There's
Root,
so many
root,
things,
yeah. And the more you've had, the more likely you are to develop a cavitation.
100%. And then you look at all these places here in the body that can be affected as an autoimmune condition. When we see the pandas, we see multiple sclerosis, we see Hashimoto's, um, sarcoidosis, we see lupus. I mean, so many of these people struggle with these things, Crohn's and celiac, rheumatoid arthritis. So many of these conditions can be helped when we start to look at what's in our mouth, because if the problem is still here, it's going to be really hard to overcome
Yeah.
gut issues. And I mean, you think about the spit you swallow. We swallow up to a liter of spit per day. And if we already are lacking adequate stomach acid to neutralize the bacteria in our spit, that right there can be a cross contamination from the bacteria that's harbored up here, now going down into our gut, kind of reseeding our gut with bad guys. And so you're caught in almost this vicious cycle of wondering, why can I not get well despite everything that I'm doing?
Yeah. Especially if you're taking, things like a lot of doctors prescribe proton pump inhibitors or acid reducers for reflux that can
Mhm.
completely ruin things. The toothpaste that they tout as being um, good for you because it's antibacterial is actually not great because you're supposed to have good bacteria in your mouth. Like the purpose of the microbiome in the mouth is to be balanced in a way that it keeps the less beneficial bacteria away. And so you don't want an antibacterial, you want a probiotic to feed and a prebiotic to feed the good bacteria so it keeps the bad bacteria at bay. So the toothpaste that you and I both use, the toothpaste that is actually those two dentists I talked about, one of them is the guy who formulated the toothpaste that we like. It's called Revitin.
Mhm.
He's got all kinds of goodness in that toothpaste, and he beats this drum till it's dead. He's like, those toothpastes are terrible. You should never, never, never do all those, things to kill all the bacteria in your mouth because you need them,
Mhm.
and if you don't, and you know, um, if you have a propensity for plaque buildup, plaque is a biofilm,
Yeah.
which is it's a thing that the body does to protect itself against something or other. So if you have a really hard time with plaque, you've got a you've got an imbalanced microbiome in your mouth. And
Mhm.
it's affecting not just your mouth, it's affecting your gut microbiome as well, and vice versa, like you said. So
100%. And so let's talk about dentists, 'cause I'm sure people are freaking out right now, wondering, oh crap, I've got this stuff going on. I've had wisdom teeth pulled. I've suffered with some of these issues.
yeah,
And these issues overlap with, if you have an existing autoimmune condition or diagnosis, they're going to overlap, and
yeah,
they could be at the root cause or one of the root causes to your health issues. The brain fog, chronic pain, joint pain, migrating pain, fatigue, basically any autoimmune condition. I mean, it's going to stem from up here because these bacteria elicit powerful toxins that travel throughout the body, as you saw where the
yeah,
nervous system connected there directly to the
yeah,
brain. It's going to cause some issues in the way our body functions and responds. And so you're probably going to have a suboptimal response in your health due to these powerful toxins. And so if you've done the right things, even getting out of a moldy home, or done Lyme treatment or whatever the case may be, and you're still struggling, you might want to go get your mouth checked out. CT, cone beam scan, computed tomography, I think CT is what that stands for, or whatever. Dentists, so you do want to make sure you can go to a site called IAOMT.org, and you can search for dentists in your area, but you definitely want to make sure that they offer smart, safe mercury amalgam removal therapy if
Yeah.
you have silver fillings in your
It's
mouth.
a, it's actually a certification. So look for the
Mhm.
smart, safe mercury removal. They have to be certified to do it properly. Because
Mhm.
think about it, because that's the whole nother topic, but like mercury is a toxic, a biohazardous waste before it enters our mouth and after it's taken out, but not in the mouth. Really?
Yeah, it doesn't make sense. The logic
Mm-mm.
doesn't add up.
So there is a proper way to take it out. Otherwise, you end up resorbing even more of the mercury than you've been exposed to at low levels because it's been in your mouth for however many years.
Right, and just to talk about some clinical deficiencies here, or features of deficiencies of different vitamins as it relates to the mouth, and I know we got to wrap up because you got to go soon. Um, a deficiency in vitamin A can cause reduced saliva, gum overgrowth, oral precancerous areas. Vitamin B1, which is thiamine, it can reduce your taste sensation. If you have a riboflavin, which is B2 deficiency, it can cause sores in the corners of your mouth, oral ulcers, swelling and redness of lips, vertical cracking or burning mouth. Niacin or B3 deficiency can cause a burning mouth, swollen red tongue, flattened gums, excess saliva, sores in the corners of your mouth. So those people who always get cracks right here. B6 and B12, dry and sore gums, burning mouth, red beefy tongue, flattened gums, bone loss, bad breath. B9, folate, can be bad breath and gum inflammation. C, D, and K, all of these can lead to oral ulcers, sores in the corners of your mouth, gum loss, burning mouth, gingival inflammation, scurvy, delayed gum healing, jawbone loss, delayed healing after extraction, low jawbone density, soft tissue bleeding, delayed healing after any extractions. There's so many here, and it's important. That's why we want to make sure that, we are eating nutrient dense diets, but that we're also absorbing what we are consuming. Um, and then,
Let me show you while you're doing that. Let me show you this little ditty here. See if you can see it when it comes up. This is we talked about the drugs. There we go. We talked about the drugs that people are on and the effect. You're talking nutrient deficiencies. Look at all the drugs that cause nutrient deficiencies in the body. Proton pump inhibitors are one of the biggest offenders. 6 different things just in this illustration here. So
that's crazy because I know so many people are probably have taken or are currently on many of these. And in
yes,
lieu of what
these
we're
are
talking,
all like the most commonly prescribed. That's the whole point of this slide.
yeah, that is just wow.
Yep.
And then we wonder why we have issues, and then oftentimes they get prescribed another medication for the side effects of that medication.
Yes.
It'd be a vicious cycle.
Yes.
And obviously, we're not here to tell you to quit your medications cold turkey. Work with your prescribing physician in order to come off them naturally, but
Yes.
you definitely need to start thinking about, what am I doing? Am I deteriorating my health, or am I on a pathway that's actually elevating my health? And how can
Yep.
I help improve that?
And take
Uh,
baby steps, like you can't eat, my mom used to tell me you can't eat the elephant all in one bite. Like you start with baby steps, take a step in the right direction. Every step will lead to another one until you've made it the whole way up the mountain and you've gotten to where you want to go. But
mhm.
you can't make a leaping bound from the ground to the top of Mount Everest.
Yeah.
Like it's a baby step kind of process sometimes. So
Mhm.
start somewhere. I
Yeah.
don't take people off of their medications when they come to me, not right away. I mean, that would be kind of foolish. When I have somebody that started recently, she's on antihypertensive medication. I'm
Mhm.
like, we're not going to do that. You've got a lot of other cardiovascular risks that we need to address, things that I know that I can reverse. Then we'll talk about that. But let's
Right.
work on these other things first. And it's all about incremental changes, making baby changes. And in another patient I saw this week for the first time, she was like, how can I detoxify my life? Well, this is a good segue into it. We have a handout that you can download from our website. We often post it on social media. And it's how to make incremental changes and doing a little bit every week, just a little bit, making little changes to remove the toxin exposure that you have in your life. It's not going to happen overnight. You're not going to be able to do it all at once. But I think the thing that I would say would be probably the best first start is go to the IAOMT website,
Yeah.
find a good dentist, and find someone who will take the CAT scan of your mouth and
Mhm.
then have a conversation and
Yeah.
see what comes up. And depending on your age, like the older you are, the more likely you've had to have more than one tooth taken out. The older you are, the more likely you are to have uh,
Yeah.
the amalgam fillings and or root canals. And as you add, it's not like a 1+1. There is like an exponential uh, ri- um, health challenge that you can face because you've added this thing and that
Compounding
thing,
effect.
it's compounded. Yeah. So start with just getting a good scan of your mouth and going from there. And somebody who will take a scan of the whole thing, not just one tooth. You need to see the whole thing.
Yep.
Uh,
CT cone beam scan is what we want to do. And I'll just
yep.
drop some names. That's what we love to do here because people are always going to be like, well, who do I go to? Again,
Yes.
the IAOMT.org website, that stands for International Academy of Oral Medicine and Toxicology. That
Mhm.
website has a library of addresses of dentists that do these things. Um, you went to Dr. Scott Chandler
I
and
went to Dr. Scott Chandler and I know Dr. Jerry Curatola. So Scott
he's in New
Chandler's in
York.
Utah. Jerry Curatola is in New York City.
I've been to a few doctors, Dr. Stephen Evans and Nate Johnson. They're in East Texas. I've been to Dr. Stuart Nunnally and Lane Freeman. They're in Central Texas, around Austin area. I've also had consultations with Dr. Michelle Jorgensen, and she's also in Utah. All of these dentists, and Dr. Carmen Burke, who's in Boulder, Colorado. All of these dentists that we just named do the safe mercury amalgam removal, and they also perform the cone beam scans, and they all understand cavitations. And so these are all great doctors that you can research if you live in those areas. And
Yep.
also, if you don't, you can go to the IAOMT website to find one near you.
And I did to oh I and just one more thing and before we go, I found somebody in my area who was certified safe amalgam removal, had a cone beam, but does not do cavitation. So you could at least start by getting the picture,
Mhm.
get the safe amalgam removal if that's your case, if that's what's going on with you, and then find someplace, to go for the surgery. So, I live in Pennsylvania, so it's quite a hike to go over to Utah to see Scott, who's a friend. I could go to Jerry, but his calendar is like I'm booking till next year, so I could at least get in this year with Dr. Chandler. So, um, but at least I started with getting the CAT scan and sending it to someone who could read it and knows what they're looking at. So,
100%. Yep, 100%.
so
That's what we did. We went here locally to the two. And then I love second opinions and third opinions because it's great to have
yep,
multiple sets of eyes just to for your own peace of mind. I mean, this is your health that we're
yeah.
dealing with, and
And
it can
I
add
got
up.
a second opinion locally, and she was like, "Oh, you have this little thing and that little thing," but she was not like. It wasn't until I had somebody who knew that they were looking at, and he's like, "Oh
Yeah.
my."
They definitely need someone with experience, and they have to have the proper technology in order to interpret a cone beam scan. Because a lot of
Yes.
people try to read these like a typical X-ray report,
No,
and
you
they
can't.
don't know what they're looking for. And that's how
Yes.
you can tell if someone is untrained. You have to have a special software that can look at this technology. And the doctors that we all mentioned have this software that they can go in and
Yes.
look at to ensure, and they have the experience too. This is what they do and
Yeah.
live by every single day. So.
Yep. So awesome.
It is. I know it's amazing, and I hope people find value in this because it's extremely important. Oral health is highly overlooked. So yeah, people get out there and make your dentist appointment with the right one. Uh,
Yes.
and we didn't even talk about fluoride or anything else. So
Yeah, that's a whole nother, yeah,
we'll have to be careful with that one because we can get censored for saying that or maybe speaking out about it. But
yeah. Just be if you filter your water and use the right toothpaste, you're off to the races. It's a good
Mhm.
start.
Revitin was one that you mentioned. You had said Wellness is another one that I use. It's got hydroxyapatite in it, which is a remineralization
Mhm.
component that helps
Mhm.
rebuild the teeth. But you also want to take some vitamin D3 and K2 that
Yeah.
can help with the remineralization and bone density. Silica and horsetail is a really good remineralization product that it's inexpensive and you can get it at most health food stores. I think 1,500 milligrams per day is what you want to do for rebuilding a tooth, and all those other nutrients that we talked about, obviously, especially if you're on medications. You just learned that you're depleting your system's nutrients there. So be careful and just do the best you can with what you have
Yeah.
control over and one day
Yes.
at a time.
Yes. And try not to be overwhelmed with all the information. Take it one thing at a time. And
Yeah,
always reach out. If you have questions, that's what we're here for.
absolutely.
Or if you need help.
Always, I hope this is a big benefit to you and to the people that were watching. Please like and subscribe and share and follow us for more tips. And we'll see you again next week.
Yeah. See you then.
All right, take care, Teresa. Thanks
All
again.
right. You too. Bye
All right,
bye.
God bless you. Bye.